Hi, my name is Darren, and I just had bilateral hip replacement. I thought I would do this video because I did not see anything online that really took me through the steps of what to expect afterwards. So let me tell you, I'm 57 years old. My hips were definitely deteriorating, and the surgeon agreed to do bilateral hip replacement. I was fortunate enough to have a doctor by the name of Michael Zywell down at Toronto Western, who was fantastic. First day, which is the day of surgery, and pre-op, first of all, the staff was incredible. It was unbelievable on how they treated you, and I was amazed. The procedure, I went in at 9 o'clock. I think it was about 2.5 hours. Really, you don't remember anything. There is no pain, there's no discomfort. Literally, it's like a great sleep. Then the next thing you know, you're in recovery. Thankfully, I had a great wing person, which they tell you need, which is my wife, Catherine, who was amazing. She met me up in recovery. I felt pretty good. You're still under anesthetic. I think it's a spinal anesthetic. Plus, they put in a fair amount of freezing into your hips, so it felt pretty good. And I realized that in order to get out of it the same day, I was going to have to pass the physiotherapist test. Probably in around 2 o'clock, the physiotherapist came in, went through some things, moved my legs around, got me out of bed, and I used the walker for the first time to walk probably about 40 steps to a physiotherapy room, in which he showed me how to get up and down stairs and back. Everything went well. After I was done the stairs, I got a little lightheaded. There's no question about it. Had to sit down in the wheelchair, but got back to the room, got better, and definitely passed my test. So the nurse came in eventually, took out the IV, and said that I was going home. So yeah, you can't expect to go home the same day. I was told that it was possible. Sometimes when you do double, though, they do want you to stay the night if there are some complications or just some issues. But I was fortunate enough to go home. My wife took me down to the lobby with a wheelchair, got the car, helped me get into the car. Thankfully, it's an SUV, so it's a little bit easier to get up into. The ride home was a little uncomfortable, just the bumps and the movements that you're not used to. Not a whole lot of pain or discomfort, I would say. You know, I was a little bit lightheaded because of the medication that I was on. I'm not a fan of medication, so I was definitely lightheaded a bit. But got home. My wife got me out of the car. She had a wheelchair in the garage just in case, but was not necessary. I was able to, we have 4 steps to get up into the house. I was able to get the steps into the house, and got me into the house without much of a problem. Got the walker out. I had borrowed a walker, which was fantastic. And then got over to this comfortable chair that I have, same thing that I borrowed to help get me in and out. Yeah, it really was going much better than I thought. And then at nighttime, same thing. I was able to get up the stairs into our room. We live in a 2-story house, just with a cane, 1 foot at a time. Definitely needed help once you got to bed with getting your clothes off, getting into bed, going to the washroom. I was definitely up a few times that night, needing help. My wife gave me help getting to the washroom and back. The one thing that I found a little more difficult was sleeping on your back. It's hard to sleep on your back all night long. But definitely, wasn't feeling a whole lot of pain or discomfort. Day two, um, same thing, needed help with my wife to get dressed and out of bed. Was able to get downstairs without a problem and sitting in this nice, comfortable chair and got myself into a routine of getting up probably every 45 minutes to an hour, using the walker to get out of the chair and just walking around the house in circles, and then sitting back down, and doing that over and over and over again. I would say you definitely notice that the pain in the hip joint is gone. What you're feeling more is probably from the surgical, and the bruising and things like that, but really not that bad. But yeah, just spent the day, walking around and sitting back down. I've been told that, getting up and moving is very important. Day three, same thing the night before, sleeping on your back gets a little uncomfortable. I feel it in my lower back, but again, able to sleep okay, no issues with that whatsoever. Still need help, getting dressed, taking one step at a time downstairs, getting into the chair. On day three, I started using the walker and a pair of crutch canes. I'll show you what they look like here. They're just like that. They've got good support on them. And started using them and the walker. I would use the walker to get up, grab the crutch the crutch canes, and I started doing my every 45-minute walk around the house with those. It definitely felt better. They were very easy to use. They're very supportive. Again, walking around, really no pain whatsoever, just more of maybe of a discomfort, a tightness, I think just after surgery and things like that. But again, spent the day doing that. We had Sunday dinner, had family over, which was really nice to see everybody. But again, spent more time just working with those crutches. At nighttime, my wife would take the walker upstairs. I would get up there with the crutches, and use the walker if needed. But I started using the crutches way more. It was way easier getting in and out of the bathroom with the crutches. I should also mention that on day two, we got a raised toilet seat in the bathroom, in which my wife brings from upstairs to downstairs, depending on where I am. Very helpful. We got it online. It was like $50, but still well worth, the investment. You will need it. But same thing, not a lot of discomfort and not a lot of pain whatsoever. Day four. Day four, I started walking. I would use the crutch to stand up from the chair and slowly walk around, not too far. Started with 5 or 6 steps, and then back to the chair. It's something you're gonna have to do anyways, so I felt okay, decent balance, and by the end of the day, I was pretty much again walking around the circle of the house, without any cane or anything necessary that way. No discomfort, no pain. When I say walking, that's probably exaggerated. Walking like, I was probably 95 years old, very slow, but indeed, walking around the house, and started again getting into the pattern of every 45 minutes, getting up with the cane, walking around. I found it a lot easier now because now I could actually carry stuff. I could get stuff in and out of the kitchen. Again, no discomfort, no pain, just again, more of a stiffness. I would say towards the end of each day, I definitely felt, I don't know if it was tired, but my body, my legs, my thighs were definitely at a point where they were tired, and you could feel that. And remarkably, every morning, they felt very refreshed and ready to go again, and used a lot of ice every 30, 40 minutes, ice on, ice off, even at nighttime. So definitely found that that helped. Day 5 was pretty much the same as day 4, except I no longer needed a crutch to stand up out of a chair. I could do it on my own and walk around. Um, Pretty straightforward. Still need a crutch or a cane to get up and down stairs, but and still having issues just sleeping on my back. Could start doing a little bit more as far as getting dressed and undressed by myself. Had a shower, which felt really good. Could stand in there by myself without a problem. But yeah, slowly things are starting to get back to normal that way, which is really nice. Day 6 was pretty much like day 5, except I was on my own. My wife went back to work. I told her I was fine. I was able to pretty much get dressed by myself, get downstairs by myself. I'm able to walk over to the kitchen and get my breakfast by myself. Got into the same pattern. Started watching a Netflix show series, Formula One, which is about a 35-minute episode. At the end of every episode, I'd get up and do some laps around the house and sit back down. I went outside for the first time on my own, just to my car to get a book that was in there, and then one of the other times I actually walked over to the mailbox, which is about 40 feet there, 40 feet back outside. But same thing. It was nice to get out. Definitely getting more and more comfortable on my feet. And that evening even went to a seminar that my wife and I had been taking, had no problems. Like I say, things are definitely getting better, without a doubt. So I thought I'd talk about medication. I definitely got some medication that was given to me to take. I'm not a fan of medication, I'll tell you from the beginning, but definitely probably helped. Initially, I was on. I have to take an aspirin twice a day. I think for the next 35 days, which is just a blood thinner, which is no problem. I was on a drug called Celebrix, or Celecoxib. Same thing, 2 a day, 12 hours apart with food, for 5 days, and they're done now. As well as they gave me a drug called hydromorphine. There you go. It is an opioid. Not a fan of it. I was given one at the hospital before I left, which was probably why my head was a little bit jittery coming home. I did take one that night in bed, thinking if I'm asleep, it really won't affect me that much, but that is the last one I took. So on day 1 in the evening, during bedtime, I took one and I have not taken another one since. The other drug that they prescribe, which is pretty easy, is just an extra strength Tylenol. 2 of those every 6 hours a day. I took those up until day 3. On day 3, I decided to stop taking the Tylenol as well. Haven't had any issues, and like I say, that's just me. I'm not a fan of medication. And the other drug they gave me was a drug called Senokot. And I guess with all the medication, you can become a little constipated. So I started off on these with 2 in the morning and 2 in the evening, and found out in day 2 that was way too much. I definitely had some issues with the washroom. I have back down. I took one on day 4 that seemed to help. So now I'm just kind of taking it as needed. But like I said, if you don't mind taking the drugs, they certainly will help. I just don't prefer them and found that I really didn't need them whatsoever. So the only thing I'm on right now will be the aspirin that I will take, for the next 35 days.
Walking outside, day number 6. There, look at me go. Yeah, it's not quite a finish line. We're partway through. We're past the distance to the mailbox, though. We're on the other side of the street.
Definitely farther than the mailbox. Well, it's been exactly 1 week since my bilateral hip replacement. At this time last week, I was in surgery. Things are going well. Definitely notice a difference in the morning. My legs are looser. They feel better, definitely rested. Still in the evening time, they get tired. There's no question about it. I am still walking around without really crutches or canes except to get up and down stairs. And today will be my first physiotherapy appointment. I will definitely check in after my first physiotherapy appointment. But all in all, things are going well. Every once in a while, I am taking I guess it's a laxative pill, I guess because of the aspirin that I'm on. But like I say, everything seems to be going in the right direction. Good times of the day and bad times of the day for sure. But definitely moving in the right direction. I will check in after my first therapy appointment. Take care. Well, I've had my first physiotherapy exactly 1 week after surgery. Went well. They were a little surprised that I was walking on my own unassisted, but got some more exercises. Plan to go back there next week. Everything seems to be going in the right direction. You can't see it right now, but I am sitting here with a little bit of ice going on. But again, everything is going well. No real discomfort other than maybe a little bit of stiffness where the incisions are. I will check in again, probably not on a daily basis, but certainly 1 week from now and see how progression is in week 2. Take care. Well, it's been almost 2 weeks since surgery, and I've just come from my second physiotherapy appointment. Everything seems to be going in the right direction. I've done a couple of 1K walks now. Things are definitely loosening up, but still at nighttime they do get stiff. It's almost like I'm back to day number 4. Thankfully, when I wake up in the morning, things are loosened up with a little bit of ice. As far as the incisions, they definitely get warm at night, but no pain or anything like that. So I would say everything has been good. Next week, I will have my first pre-op appointment with the doctor, and we'll let you know how things go from there. My hope is by next week I will be driving and heading back to the gym to do some light workout. Take care. Well, it's been exactly 2 weeks since my bilateral hip replacement, and just checking back in. So on the pro side, I drove for the first time today and went and got a coffee. Everything seems to be fine. There's no issues. I'm on no pain medication. And moving my foot from the right to the left is not a problem at all. Progression seems to get slower right now. There still is some progression as far as flexibility and things like that, but it seems to be a little bit slower. I'm still doing about a 1K walk every day, as well as my exercises 3 times a day. On the downside, still having a problem to sleep. I end up starting in my bed, moving to another bed, sometimes moving to a couch, sometimes moving to a chair. It definitely seems to be an issue with getting comfortable. But all in all, the bandages are still on. My next check-in will be next week, pretty much at this time. I have my post-op appointment with the surgeon, and I assume he'll take the bandages off, and we'll go from there. But so far, 2 weeks in, everything seems to be working just fine and heading in the right direction. Well, it's been exactly 3 weeks since my surgery. Everything seems to be going fine still. I'm still having troubles at nighttime sleeping. But other than that, the progression seems to be good. I'm still walking about 1 kilometer a day. Some physio appointments. I started back to the gym about 3-4 days ago. So I do about 2 hours at the gym now on a spin bike, and then going through some weight routines that I normally do just with a lot less weight. Still sore at night, and definitely stiff when you get up from a chair or something like that. But all in all, like I say, everything is going in the right direction. I've got 1 more week off before I go back to work. And I'm at the gym now, so I'm going to go in for another gym session. But like I say, I have 3 weeks in. I had my appointment yesterday with my post-op appointment with the surgeon. He was happy with everything, took the Band-Aids off, and basically said that he would call me in a year. So again, all is good and heading in the right direction. Take care. Well, it's Friday, and it's been exactly 4 weeks since my surgery. All seems to be going well. The nice news is I'm sleeping better. So a little bit easier finding positions. I can sleep a little bit on my side. So all is good. Recommendations, keep doing the exercises they give you. If there's a treadmill available to you and a stationary bike, start walking on the treadmill. That way you can keep track of your pace and increase the pace as you get better. And same on a stationary bike. Ride it with low tension, and then gradually you can increase the tension as you get better and stronger. I've definitely been walking on a treadmill now and stationary bike for at least the last 2 weeks. I walk 1 kilometer on the treadmill almost daily, and I've been doing about 10 kilometers on the bike daily as well. Swimming, I really enjoy swimming, so I was back in the pool about 2 weeks ago. And if there's a pool available to you, I would definitely recommend getting in a pool. If you don't swim, then you know what? Do some of your exercises in there. There's resistance. When I'm done my normal swimming now, I do side steps in the pool, and then I do running in the pool frontwards and running in the pool backwards. It all seems to help. It doesn't hurt, and everything seems to be getting better. I still have a bit of a limp on my walk. My legs are not healing equally, that's for sure. I notice some stiffness on one side that I don't notice on the other side. But like I say, all in all, it seems to be good. And I am going back to work on Monday. So other than that, good luck with your surgery. Well, it's been exactly 8 weeks since I've had my bilateral hip surgery, and all is going well. I'm pretty much back into a normal routine as I was prior. I've started doing 2 hours of biking every morning, 5 days a week. I'm swimming somewhere between 8 and 9 kilometers a week, and I'm hitting the gym for 2 hours to 3 hours a week as well. I've started playing a little bit of pickleball. And the only really side effects is around the incisions. I still have a little bit of numbness on both sides, but that seems to be going away. It was definitely more numbness before, but it seems to be, subsiding. Sleeping has been great. There's no aches, there's no pains. It's kind of nice if I slip or something. Again, there's no ache or pain like there was before. All in all, I would say it was well worth doing what I did, and the recovery hasn't been bad as long as you put the time in and do the work. My last 1 kilometer walk was yesterday on the treadmill. and I've started doing kind of a walk and jog. 1 kilometer I'm doing in just under about 9 minutes. I'm not sure if I'm going to get back into running. I think I could. I just don't know if I'm going to, if it's worth doing it and wearing out hips again. But like I say, everything has been going great. And if you decide to do it, I think I think you'll find that the recovery is quite well. Again, I hope these videos and that have helped. If you've noticed, I've shaved. The reason I've shaved is my wife prefers it this way, and my wife was so great during this time in helping me out that it was the least I could do is shave. But again, I hope these videos and things have helped make a decision and that. And the reason I did this is because I really didn't see anything online, and I was really looking for a lot of information on where I could get back to and how long it would take. So again, I hope this helped. Again, thank you very much for watching.